to invite the Commissioner of Social Affairs, Her Excellency Amira El Fadil, to give her statement. Commissioner.
Thank you, Winnie. Excellency, Deputy Chairperson of the African Union Commission, Excellency Director for Disease Control and Prevention, Dr. John Kingsong, Deputy Director, Dr. Ahmed Okwel, participant from Africa CDC and Interim Director of the clinic, and all participant journalists. Thank you very much for attending this very important ceremony and press conference. Excellency, I started by congratulating all of us of Africa Day. Happy Africa Day to all of you. Happy Africa Day to all of Africans in Africa and in the diaspora. And also I would like to say Happy Eid al-Fitr al-Mubarak to all the Muslims around the world who are celebrating Eid al-Fitr al-Mubarak. Excellencies, today we are going to launch this fellowship, but let me say that while we are launching Annan Health Fellowship, we are saluting our founding fathers, because today we are celebrating the 57th anniversary of the establishment of OAU, now AU. So our appreciation, our happiness is to have the launching of this fellowship on the same day we are celebrating Africa Day. The launching of this fellowship on the same day we are celebrating Africa Day. And let me here salute 3 Ghanaians. The Ghanaian in the room, His Excellency, the Deputy Chairperson of the African Union Commission, and one of the prominent founding fathers of our Organization of African Unity, President Kwame Nkrumah, the father of the Pan-Africanism, and also Kofi Annan, the subject of today's fellowship. Today, the world is facing an unprecedented health crisis caused by COVID-19. The Africa Centers for Disease Control and Prevention, Africa CDC, was launched in 2017, January, following the Ebola outbreak in West African countries. As we celebrate Africa Day today, we must pay tribute to all victims of the COVID-19 in Africa and in the world. And also at the same time, we wish quick recovery for the infected people. The vision and wisdom of the African heads of state to establish the Africa CDC was the kind of visionary leadership that Mr. Kofi Annan exemplified. We are honored that the family of Kofi Annan accepted the request made by the governing board of the Africa CDC to name the Global Health Leadership Fellow Program after him. I would like also to thank the effort of the Deputy Chairperson, because through him we have made the communications with the foundation and with the family. Mr. Kofi Annan will be remembered as the man who led nations to the 21st century, leading concerted efforts against poverty and diseases. His leadership in the fight against HIV was visionary. Mr. Annan played a critically important role in the creation of the Global Fund at a time when HIV, tuberculosis, and malaria appeared unstoppable. Beyond the many lives saved, the collective achievements of the Global Fund partnership encompass vibrant communities and thriving societies that can be attributed in no small part to Mr. Annan's leadership. That is why the Africa CDC Governing Board recommended to name the program after him. I am very honored that my department, Social Affairs, continues to work very closely with the Global Fund that Mr. Annan was instrumental in establishing, and we are jointly implementing the catalytic framework on ending HIV, AIDS, TB, and malaria. And we have been part of the efforts of the replenishment of the Global Fund. After this COVID-19, also, we have held a meeting with the chair of the Global Fund, plus Gavi, on the issue of the vaccines and to make sure that Africa will have accessibility to the developed vaccines and it will not be left out of it. Excellency DCB, dear participants, I personally look forward to working closely with the Kofi Annan Foundation and the family of Kofi Annan to implement the Global Health Leadership Program. And I'm very pleased to be part of this ceremony in the presence of His Excellency, the Deputy Chairperson, and my greetings to my brother Sisi. It's nice seeing you, and I welcome you on behalf of Africa CDC and on behalf of Social Affairs Department. Thank you very much. Assalamu alaikum.
Thank you very much, Commissioner. Can I just remind all the journalists a Q&A session, and the means by which you can ask your questions is by sending your questions to WhatsApp number +251 9455 02310. Let me just repeat that number again, +251 9455 02310. I should also remind you that we are coming to you live from the African Union Commission, and we are also available on all platforms, including YouTube and Facebook. It is now my pleasure to invite the representative of the Kofi Annan family, El Hadji Assi, who is joining us online. Over to you, El Hadji.
Very much. Good afternoon, Excellencies, friends, colleagues, ladies and gentlemen. It's my honor and pleasure to deliver to you a statement, by the Kofi Annan family. And here it reads: "We are very moved that our beloved late husband and father will be honored by the African Union in naming its global health leadership platform after him at the Africa Centers for Disease Control and Prevention. He was a visionary with the power to realize his dreams. Seeing the devastation of HIV/AIDS, he threw himself into a response, and we witnessed the birth of the Global Fund to fight AIDS, tuberculosis, and malaria. He had a strong belief in Africa and its talent, and we are certain that he would have approved of strengthening its capacity to face the immediate crises of today and developing its enormous leadership potential to respond to future challenges. So best wishes to the African CDC and best wishes to the leadership program. End of quote. Thank you very much.
Thank you very much, El Hadji. We will be coming back to you for you to deliver the statement on behalf of the Kofi Annan Foundation. You have the floor again.
Thank you very much. Now, mine is just to bear witness, to a journey traveled together with late Kofi Annan, and a great privilege that I have today to chair its foundation. Now, back in 2001, I was a UNAIDS staff member appointed in New York to coordinate the first UN General Assembly special session on HIV/AIDS, which was, the first time, that the Assembly come together, and even the Security Council to address an issue which is of social and health nature beyond the security issues that he was dealing with. That would not have happened, without the strong voice and leadership of late Kofi Annan. At the end of the special session, he came up with the idea of a war chest to respond to HIV/AIDS, particularly in Africa. And as you rightly say, that led to the creation of the Global Fund to fight AIDS, tuberculosis, and malaria. And I had also the privilege to be the first Africa director of the Global Fund at its inception at the time, working very closely with late Kofi Annan. In 2014, when he was even out of office, and we had the Ebola outbreak in West Africa, he convened us all again to see how we can not only develop a response that is reactive, but to place a system that would be better prepared to withstand health shocks and hazards when they happen in the continent. At that time, I was heading the International Federation of Red Cross and Red Crescent Societies, and that is under the leadership of late Kofi Annan that we had the partnerships together also with African CDC that at that time already showed what it means to be prepared and to respond effectively at the local level to prevent a shock and hazards from becoming a disaster. Many at the time thought we would have a disastrous situation, but thanks to the leadership of the African CDC, we did not see the disaster that many were fearing at the time. And I think that inspired what is happening right now today, when we see the first sign of COVID-19 across the world, the most pessimistic prognosis were put. Millions of people will die, in Africa. Well, we saw again the Africa CDC at the forefront, preparing the countries, giving the right information, providing support in terms of testing, and advising on the appropriate public health measures to be taken. And we believe that if those efforts are sustained, all the pessimists, will be proven wrong. And that is the reason why it is a great privilege and an honor for the Kofi Annan Foundation, which I have now the great privilege, to share, to be associated, with the African CDC. One of the most important vision and commitment of late Kofi Annan was to build capacity and also to pass, to the next generation, the wisdom as well as the capacities that are required, to continue to lead on our continent. And that fits very well with now this leadership program and this fellowship that is coming together on the African continent by the African Union and the African CDC. You can imagine the pride of a son of Ghana who became a son of Africa, and then later on a son of the whole world. A voice of wisdom, the voice of credibility that we are missing so much today in this crisis that we are facing. But his legacy will continue to live on through your leadership and through the great honor that you are putting to him, to his family, and to the foundation by naming this fellowship to him. So we will look forward to continuing working with you, supporting your initiatives, and also count on the Kofi Annan Foundation, to be always on your side, in this journey. Thank you very much.
Thank you. Thank you very much, Alhaji, for those remarks. It is now my honor to welcome the Deputy Chairperson of the African Union Commission, His Excellency Ambassador Kwesi Kwate, who has the honor of launching this very important program that will be called the Africa CDC Kofi Annan Global Health Learning Program, Leadership Program. Excellency, you have the floor.
Good evening, colleagues, distinguished ladies and gentlemen. Statement on the launch of the Kofi Annan Africa CDC Global Health Leadership Program. Your Excellency, my dear sister, Commissioner Amira, Commissioner for Social Affairs, my distinguished brother, Dr. John Nkegason, Director of Africa CDC, Dr. Elhaj Asi of the Kofi Annan Foundation, colleagues, brothers and sisters, ladies and gentlemen. On behalf of the chairperson of the African Union, President Matamela Ramaphosa, on behalf of the chair of our commission, Dr. Musa Faki Mahamat, I should like to congratulate and to wish all of you a happy Africa Day and a happy Eid Mubarak. On this day, 57 years ago, the Organization of African Unity was formed with the aim of liberating the continent from foreign rule. Today, as we speak, our organization has been transformed into the African Union. We have signed and ratified the Africa CFTA agreement and are slowly but surely in the process of developing the Africa we want, an integrated, prosperous, and united continent, democratized, stable, and seeking to silence the guns. Today, we're pleased to announce the Africa CDC Kofi Annan Virtual School of Public Health Leadership and Management Program. This program, intended to help develop African public health institutions with public health leadership to transform our public health institutions into effectively led, effectively managed, world-class technical entities. Now, this can only be achieved by attracting and developing highly seasoned public health professionals from both private and public sector organizations. Hence, our desire to have this program named and operating under the auspices of our dearly departed former Secretary General of the United Nations, His Excellency Kofi Annan. Mr. Kofi Annan, as everybody tended to call him, was a global public servant who exemplified the highest standards of visionary, principled, and committed public service leadership. As we were told by the Commissioner of Social Affairs, he was instrumental in developing the Global Fund for AIDS, TB, and malaria, and this became a game changer in containing this health challenge in Africa. At this time, today, when the world is faced with COVID-19, the COVID-19 pandemic, we believe this program, under the auspices of the Africa CDC and the Kofi Annan Foundation, is an idea whose time has come. Health, in Kofi Annan's words, is to be seen as a human right to be fought for and not a blessing to be wished for. Kofi Annan always emphasized and stated that good governance lies at the heart of meaningful public health and global public health delivery. The truth of this assertion has been demonstrated clearly by the reaction of the whole world to this pandemic, when some of the richest countries are found to be floundering. It has demonstrated also that the best public health response to global pandemic is in reality the strength of our public health systems. As he used to say, we must learn to govern well nationally, and we must learn to govern better together as one world. Thank you for your kind attention, and I hereby declare this program duly launched. Thank you.
Thank you very much, Excellency. And congratulations to Africa for the launch of such a very vital program in our health response efforts. We have a question. The first one comes from Coletta Wanjohi, and she's with FSN Agency. And Coletta asks, could Africa CDC kindly expound what the program entails exactly and how relevant it is, especially now when health infrastructure is emerging as the priority for the continent with COVID-19? Dr. John.
Yeah. Thank you so much, and Excellency, and for your active participation and for the active launch of this historic program for our continent. The Kofi Annan Global Health Leadership Program has three components. First is a fellowship program that will focus on leadership and will bring the best minds through a very competitive manner to the Africa CDC and the African Union Commission to begin to understand the nexus between public health, human rights, development, and economic issues. We are in the 21st century, and we've now seen, as Kofi Annan saw many years ago, that to solve complex problems for health requires a multidisciplinary approach. That is exactly what that program will do by bringing leaders here, emerging leaders from across our countries here, and mentoring them and offering them the unique platform that exists within the African Union Commission through the different commissions and integrating that with public health challenges in the 21st century. The second component of that program includes a program that will enable us to begin to position scholars. We're calling it a public health scholar program, where we'll bring the best minds on the continent and embed them within ministries of health and national public health institutes for them to mentor, create an atmosphere that they provide strategic advice to the leadership of the ministries and guide them in analyzing complex issues and solving them across the board, again, using a multidimensional, multidisciplinary approach. The last component of the program includes a think tank, what we're calling the Virtual Leadership Academy. That will be a discussion forum without walls, where you bring the best minds across the continent through a visual platform to discuss complex issues and find solutions that will enable Africa to position itself in the 21st century in what we are calling a new public health order for the continent. We have to recognize that the way that we came into this crisis, the COVID-19 crisis, must be different from the way we emerge from the COVID-19 crisis as a continent. It is only through that platform that you can harness the potentials that exist across the continent in a way that cuts across the different age groups, in a way that cuts across the different professions, and in a way that cuts across the different dimensions that we have on the continent. So that is the Virtual Leadership Academy that will provide that platform. So those are the three different components of the Kofi Annan Global Health Leadership Program.
Thank you. A follow-up question for that one is, when will this program start working?
So we intend to get going with a virtual leadership program as soon as in August. Because of the challenges we're having with the movement of people, we will delay the two other programs, that is the Global Health Leadership Fellow Program and the Scholar Program, to the end of the year or beginning next year. But it will allow us space to launch a competitive process, design the program, and look for the faculty. So that delay that will happen will actually be a good thing. But again, the Virtual Leadership Academy program will officially start at the beginning of August.
Thank you very much. We have a question from Betty, but Betty doesn't say which media institution she's representing. But she's asking, what is the significance of launching this program today? Because it is Africa Day.
This, as Commissioner Amira indicated, and His Excellency, the Deputy Chairperson, this is the Africa Day, and we are honoring. There was no best moment or better moment than today to launch the Kofi Annan Global Health Leadership Program, especially given the context we are operating. We're living in a world that is unparalleled to anything we have observed in the last 100 years. And there's no other person that we can think of in Africa that could have reasoned us through and chart a vision for us to solve this unprecedented crisis like Kofi Annan. And he proved that in many aspects. Mr. Annan was the first person who brought public health to the attention of the United Nations, and that led to a resolution that for the first time made HIV/AIDS a security issue for the whole world. And then very shortly after that, as we've heard multiple times, launched or was very instrumental when he stepped up in Abuja in Nigeria and then in front of head of state and chart the future of the global fund or the need for that. So today is very symbolic for the continent, but it's particularly unique that in where we are looking for the future, we are asking the question, what would Kofi Annan be telling us to do today? And there's no better moment than evoking that visionary aspects of Mr. Annan.
Thank you very much. We have a question from Ghana, and it's from Della Russell, and she's with the Daily Graphic. Is the program to be funded by the African Union, or just like any other programs, the AU will be looking up to donor agencies to provide funding for it?
The program will be funded as an integral part of building capacity for the continent, and it will be then, of course, it means it's embedded within the standard budget of the Africa CDC. The program will also benefit from partnerships as we speak. I'm happy to declare that the director of the London School of Tropical Medicine and Hygiene, Professor Peter Piot, who was his lieutenant-in-chief to fighting HIV/AIDS as the executive director of the UNAIDS, has committed the London School to supporting this program as well. So as we know, Mr. Annan was a Ghanaian, Mr. Annan was an African, and Mr. Annan was the world. So it has many partners are already lining up there that will support this program as well. And of course, the private sector, reaching out to the private sector to make this program a prestigious world-class program that will honor Mr. Annan and honor the continent.
Thank you very much. Perhaps our last question, the role of African specialists in this program. What role will African specialists play?
We expect that the faculty that will support this program will of course, reflect what Mr. Annan's vision was, the ability to bring people together across the continent, but across the world as well. We are looking inward and owning the program and leading the program, but we also recognize that we live in a world that Africa is interconnected in a way that is unprecedented. The COVID-19 crisis or pandemic is telling us that we thought we were connected, but we are more connected than we thought. So the faculty and leadership will come from the continent, but it will lend itself to any expertise that is out there in the whole world that is ready to support the program.
Thank you so much. That brings us to the end of our press conference. And just to reiterate that the purpose of this press conference was to launch the Africa CDC Kofi Annan Global Health Leadership Program. It is therefore now my honor to just thank His Excellency, the Deputy Chairperson of the Commission, His Excellency Ambassador Kwesi Kwate, the Commissioner for Social Affairs, Her Excellency Amira El Fadil, the Director of the Africa CDC, Dr. John Nkengasong, El Haji Assi, who joined us live, who was representing the family of His Excellency Kofi Annan, as well as representing the foundation of Mr. Kofi Annan. I'd like also to thank all colleagues who joined us for this press conference, and to all my colleagues from the media who joined us this afternoon. Thank you very much. This brings our program to an end.